Removable partial denture therapy, or what we know as RPD, is an adequate form of treatment for patients with missing teeth. Marcos paid attention that principle designed for RPD was controlling dental plaque for the prevention of caries and periodontal diseases, because RPD in the mouth has the potential for increased plaque formation on tooth, especially to abutment tooth, to which clasp and attachment are attached. Therefore, it is important to obtain good denture prognosis and performance for a long period. The objective of this project is to determine patient satisfaction during treatment in Faculty of Dentistry UKM and to determine patient satisfaction after denture delivery. The last objective is to determine the quality of life and periodontal health after receiving treatment for removable partial denture in Faculty of Dentistry of UKM.
To examine the periodontal, which are the plaque index, silliness over low, calculus index, green vermilion, bleeding on probing depth, gingival recession, and tooth mobility. Firstly, for plaque index according to silliness over low index 1964. Second, calculus index according to green vermilion index 1964. Third, bleeding on probing according to Ainamo and Bay 1975. For probing, pocket depth was measured from the crest of the gingival margin to a probable pocket depth using a Williams probe and grid to the nearest millimeters. Measurements were made in 4 surfaces in abutment teeth, mesial, oral, distal, and vestibular surfaces. Scores ranging from 0 to 3 represented the highest PD observed. 0 for normal probe depth of 2 mm or less, 1 probe depth of about 2 mm but not greater than 3 mm, 2 probe depth greater than 3 mm but less than 5 mm, and 3 depth greater than 5 mm or more. Gingival recession was measured in abutment teeth according to its presence or absence of it. Tooth mobility was recorded according to Miller 1985 from 0 to 3. 0 no mobility, 1 mobility smaller than 1 mm in horizontal direction, 2 mobility more than 1 mm in the horizontal direction, 3 mobility in apical vertical direction. These clinical measurements were taken immediately before insertion of the RPD, then 1 and 3 months after insertion. All patients receive the motivation and instruction for their oral hygiene in order to create a high level of cooperation.
On to data analysis. For part A, it's the general information of the patient. Most of the RPD patients are from 21 to 80 years old. Females are more than male, and majority of them are Malay ethnics. The most number of teeth that's replaced is 1 to 4 teeth, and most of them are from Kennedy classification class 1 and class 3. Majority of them has chronic periodontitis. Next, part B, patient satisfaction during treatments. More than 75% respondents are satisfied with the appointment facilities in UKM. Not many respondents stated that they are uncertain for the question, but it doesn't affect our result anyways. More than 75% respondents are satisfied with the behavior of clinician and staff. And more than 75% respondents is satisfied with the quality and efficiency of the treatment provided in UKM clinic, except 75% stated that they cannot remain patient in the clinic. From this, we can conclude that the respondents are satisfied during the treatment in UKM clinic.
So next we move on to part C, patient satisfaction after denture delivery. first one is about the function of removable partial denture. So for overall, more than half of the respondents don't feel pain when wearing the denture. So according to the table, we can see that 75% of people are satisfied with our partial denture. Next is about the structure of removable partial denture. Here also, most of the patient satisfied with our removable partial denture, which is 75%. Next is about the denture hygiene care. And the denture hygiene care is quite poor because more than half respondent agrees that food stuck underneath the denture and difficult to keep the mouth clean. Next is about the periodontal condition. The periodontal condition of all the respondent is averagely good, and for the last, we know that the general opinion about the service in dentistry faculty in UKM is most of them are good, which is the frequency of 14. That's all.
As for the conclusion, patients have no major issues and majority of them are satisfied with the services and facilities. However, the number of patients that doesn't want to continue their treatment in UKM is concerning. Overall feedback from patients tell us that the patient basically are happy with their experience and treatment outcome in UKM dental clinic. However, we need to work on to maintain our good services and improvise certain aspects.